Hello YouTube, we are Pediatrician brothers and today we're gonna discuss how to behave in pediatric emergencies, part 1.
First of all, we're going to talk about choking and David is gonna explain what we need to do in the event of the choking.
First of all, in this scenario, we need to assess whether the baby's airway is fully obstructed or not. To check this, we need to pay attention whether child is able to cough, breathe, cry, or make any sound. If they're not able to do these things, it means that the airway is fully obstructed and we need to resort doing Heimlich's maneuver, which is done in several different ways, depending on the age.
In infants, we hold the baby in one hand while prone, supporting the neck and the face, and we perform 5 back thrusts. If it is not successful, we should put the baby in the prone position, supine position, while supporting the neck and head and perform 5 chest thrusts. The baby should be slightly tilted downwards so the object can fall away. We continue doing this until the foreign object is removed and the airway is patent or baby becomes floppy, which means that we need to perform first aid, which will be discussed further down the video.
In children older than 1, we need to lay them on our lap facing downwards and perform 5 back thrusts, or if this does not help, we resort to 5 abdominal thrusts, during which a child should be slightly leaning forward and we should be behind the child if needed. Kneeling down, putting our fist between the belly button and chest bone, thrusting up and towards ourselves. If the baby is too big to fit on the lap, we should straight away resort to chest thrusts.
If the child goes unconscious, you should call the EMT, check inside the baby's mouth, and if you see the object, remove it. And start doing CPR. Do not at any time leave your child alone.
In the next section, we will discuss how should we do the first aid correctly. In the first place, you should check the surroundings and make sure that there are no hazards that pose a threat. If you are indoors, make sure that you open the window to protect yourself from invisible threats.
After that, we should absolutely check the child's responsiveness by talking to them first. If they do not respond, try tactile stimuli. If they respond either of these, continuously observe whether child is okay or if she or he needs help, right? If they do not respond, you should absolutely call the emergency number, and if you are not alone, task someone with it while you continue doing the first aid and the next step that David will explain now.
The next step is opening the airway by head tilt and chin lift method and checking inside the mouth for foreign objects. If you identify the foreign object, try removing them without pushing them further down.
After you have checked inside the mouth, hold your airway open so you can check the breathing, and you should for that keep your ear close to the mouth and nose and look at the chest. You at this time simultaneously check for breathing sounds, breathing movements, and obviously you should feel the air moving on your cheek. If you cannot detect the breathing sounds, you should at least give 2 rescue breaths and observe that the chest rises and the airway is patent, which means that air is going from mouth to the lungs.
If child does not start breathing, check for the pulse to detect whether the circulation is present or not. Check the brachial artery before 1 year of age and on the carotid artery if children is older than 1 year.
If child does not breathe and there is no detectable pulse, we should move to doing CPR. Chest compressions and artificial breathing ratio should be 15:2 as per American Heart Association. Chest compressions should be done on the lower third of the chest bone, and the chest compressions should be counted loudly so we do not lose the rhythm, and if someone is helping us, they can also hear us. The rhythm should be 100 to 120 a minute. After each breath, we should wait until the chest returns to its initial position, and in children we always start with artificial breathing.
In infants, chest compressions are done with 2 fingers. In children between 1 and 8 years old, we do it with a single hand. In children above 8, we do with both hands. This, however, is not dogmatic, and if the child is too big or too small for the age, we can switch the method of compression.
After every 4 or 5 cycles, we should reassess whether there is breathing or pulse, so we are aware of the situation at hand.
If at any point we detect that the child is breathing, hence there is a pulse, we should put child into safe position.
How to put the baby in safe position we will show you in the next part of this video. Subscribe, like this video, and send it to your friends.
Goodbye, I hope you enjoyed the video.